Good morning. Wache, bonjour à tous. Je suis Charlie Angus, député fédéral de Timmins Bay James. And we are here on the unceded territory of the Algonquin Nation. At the beginning of this press conference, I'd like to express my deep sorrow and condolences for the loss of a beautiful child in Peawanuck from a horrific house fire. And we're thinking of that family in Peawanuck today because it really speaks to the systemic negligence that First Nation communities are living under and the lack of basic services, basic infrastructure, a community that was left without fire services when the government knew that this community needed fire services. So we want to think of the Wabano family today and their grief and the grief of the community. The Prime Minister is meeting with the premiers to deal with the crisis in healthcare, and we support this meeting. It's so important. But if Canadians are just discovering that there's a crisis in healthcare, Indigenous communities have been living this reality for years. And the exclusion of Indigenous participation in talking about the systemic inequities is simply not acceptable. I'm here this morning with Grand Chief Alison Linklater, the Mushkegowuk Tribal Council, Chief Gaius Wesley from Kashechewan, who've come here to express their concern that these issues of inequity are not being that are not being addressed by the Prime Minister or the premiers. Again, you know, we know that COVID stripped the medical system right down to the bare bones, but in Kashechewan, when there was a COVID crisis, the community had to deal with fundraising from the public to get medical supplies in because the federal government simply abandoned the community. That is the reality. When we talk about long wait times in ER, we have communities where we don't even have proper health services. We have what they call them the Tylenol clinics. So if you have meningitis, they give you Tylenol. Elders with cancer, Tylenol. That is the reality, and people die. We don't know of any other community in the country where children are medevaced out for all manner of illnesses because there was no medical support in the communities, and this has to end. So today we're calling on the Prime Minister that he has to live up to his obligations. Under the Charter, under the treaties, he needs to sit down and commit to a national consultation and a commitment to work with First Nation communities. Same as he's talking about the premiers, transfer of funds, medical standards, because the systemic underfunding in medical systems in the northern communities that particularly that I know of in Treaty 9 and Mushkegowuk territory, it's unacceptable. In 2023, it has to end. C'est clair, la crise du système de santé canadien est grave. C'est important que le Premier ministre rencontre les provinces pour améliorer la situation, et nous soutenons cela. Mais c'est inacceptable que les Premières Nations ne soient pas invitées à participer à ces discussions. La réalité est claire. Les Premières Nations souffrent d'un sous-financement systémique. Peut-être la crise du système de santé est une surprise pour les Canadiens, mais c'est la réalité pour les communautés autochtones du Canada. So, ce matin, je suis en solidaire des Mushkegowuk Cree qui sont ici à Ottawa pour défendre le droit de participer pour le développement d'un meilleur système de soins de santé pour les communautés autochtones partout au Canada. I'm going to turn it over now to Grand Chief Alison Linklater. Thank you, Miigwech.
Good morning, Wache Misue. My name is Alison Linklater. I'm Grand Chief of Mushkegowuk Council. I'd like to start with just acknowledging the land that we are on, the Anishinaabe Algonquin Nation, and those that call this meeting place home. I'd like to send my condolences to the Wabano Itel family in Peawanuck. They suffered a great loss. Their baby girl passed away in a fatal fire this past week. And I just want to start with what Peawanuck went through. with this tragic loss. And also, to the survivors of the house fire. The nursing station went through a low supply of oxygen during that time, which should not have happened. We should have learned from what happened in 2016 in Webekwe First Nation, where they ran out of oxygen and one of their members passed away soon after. I do support the talks between the provinces and Canada. Our nation is suffering a crisis within our health system through underfunding, major shortages of human health resources. And these are things that our First Nation communities have faced even long before COVID. And I'm sorry that our country is going through this, but we have faced this for numerous years. And it's time for the federal government to meet with us to discuss what is needed to improve our health systems. It's been too long that we've been just accepting status quo and no more. And we would like to have a nation-to-nation meeting with the federal government to ensure that we, First Nations people, can have equitable health care. It is
Please
time
enter the
that
meeting
we have
passcode followed by the pound sign.
quality health care in our communities, have access to all the supports and services that our people require to live healthy,
You are
to
in
live
the
well
meeting now.
in our communities. It is sad that our children have to leave, our elders have to leave, people have to leave their communities to obtain better health care elsewhere. People have to relocate. Many have to relocate because of dialysis when they cannot receive this at home because of the water.
Recording in progress.
The quality of the water systems in our communities. Some are still on boil advisory. We shouldn't have to live this way. So I'm calling on the federal government to meet with us, to start these discussions as well. We deserve proper health care. Our children, our youth, our men and women, our elders. It is time. This legislation that is being developed, we need to be a part of it. It needs to be led by us. And we want true partnership when it comes to developing our healthcare systems. Not just to be told what is coming, what we can provide in our communities. It has to be true collaboration and partnership. So I'm hoping, with this press conference and standing up for our people, that the Prime Minister will hear us and want to meet with us. If not, we'll continue to fight, continue to stand up, and make sure that our people deserve what they so long need, is quality health care in their home communities. Miigwech.
Watching Mr. Kinoyo Tahtagatustamik Mr. Agano Bahtamigumayo Chakashti Balistigan. Greetings everyone. My name is Gaius Wesley, the elected chief of Kashechewan First Nation. Our community has faced so many challenges in terms of health care, primarily because of the bureaucratic system that's in place that creates so many barriers when our community members are trying to access the proper health care that they need. Recently, I had dealt with a few urgent crisis in my community where the nursing shortages happened just last fall, where only 3 nurses were only to take care of approximately 2,000 people in my community, and they were expected to work 24/7. Just after the New Year, we had a lot of children that came into our nursing station in our clinic because of the RSV virus, that they had respiratory complications. They were in the clinic, they were in their homes for 5 to 7 days or even up to 10 days before they can get medevaced out to get the proper medical assessment and treatment in the south. Recently, just a few days ago, a man from my community that had to relocate to Timmins just so that he can be closer to the hospital because of his complex medical health issues. He had an appointment in Sudbury, but the agencies that we rely on to take us to these places to get our proper health care, our proper treatment, NIHB, refused his request. They denied his travel accommodations to attend his medical appointment because he was living off reserve. You know these systems that are in place doesn't recognize the inequities, the challenges our people face because of remoteness. A lot of our people have died because of the system that the government continues to operate on reserves. A lot of times our community members kept going back to the clinic over and over again only to get discharged, to go home. Here's a Tylenol. You use that. And oftentimes they go into medical distress and the lives are lost. That's another system that's broken in our communities. You know, the government talks about reconciliation. The Truth and Reconciliation Commission that was established a few years ago. The Prime Minister made a commitment to pursue reconciliation with the First Nations communities. In my perspective, in my view, with reconciliation is the fact that the First Nations people need to determine how that reconciliation looks like. The details where we determine, where we design what reconciliation is. Because it is so important, because it is us, the First Nations people, that has suffered long enough with these inequities with all sectors that the government works with, such as housing, health, education, and so forth. We know better. We know very well what reconciliation can look like. The government cannot decide what reconciliation is for the First Nations people. It needs to be the First Nation leadership, the community members, the grassroots people that will determine it. The Prime Minister and the Premiers are meeting today. The First Minister is meeting to discuss the health funding transfers to the provinces. Under the treaty that we have with the Crown, both Canada and Ontario, these health transfers need to go directly to the communities as opposed to these transfers going to the provinces. Right now, we've seen a statement from the National Chief last night that the First Nations are 100% excluded from these discussions, the first initial meeting that's happening today. She's not invited in the room. And that is why it's very important that the First Nations people needs to be part of this discussion, that needs to be on the table to discuss the health priorities of the First Nations people. We desperately need that. We need that because our people have suffered for so long the health inequities, that the challenges to accessing the quality of healthcare services. It cannot continue We need to address the immediate needs in our communities in terms of health. It is very important. It's critical that we discuss these, to build a dialogue on these proposals that we want to bring forward to the prime ministers and the premiers. We don't know what's being discussed today because there is no First Nation representation in the First Minister's meeting today. We need to ensure that we are in that table, and that's what we are here for. We need to be on that table so that the First Nations back home, our people back home, can be better represented. I'm calling on the Prime Minister, the Premier, to meet directly with the First Nations people so that the First Nations can be part of the decision-making with these health transfers across Canada, in Ontario, in Kashechewan First Nation, and in any other First Nation communities across the country. We need to be part of it. And we will continue to fight. We will continue to address these issues. But it doesn't have to take an additional 5 or 10 years before things can happen in our communities. Things need to happen now. Our people are dying within these bureaucratic systems that are in place. Or better yet, we need to abolish the bureaucratic processes that are in place and hand these programs and services in the hands of the First Nations people. That will redesign them. That will design them to better reflect the needs of the people. That's what we need to do. And that, to me, would be the true reconciliation, what the government talks about. Miigwech, thank you.
Thank you. And I just, before we take questions, also wanted to point out that we spoke this morning with Grand Chief Derek Fox from the Anishinaabe Nation, and that Treaty 9 is supporting the call for Mushkegowuk for the Prime Minister to step up with a meeting. And Chief Derek Fox is going to be holding his own press conference in Thunder Bay to talk about NAN's health priorities. So if we have any questions for the Chief, for the Grand Chief, we'll take them now.
Mike? No?
No, there's no mic.
Okay, my first question is for the Chiefs. I want to thank you both for being here. My name is Brett Forrester. I'm the reporter for CBC Indigenous. We know the provinces are asking for a massive multi-billion-dollar immediate boost to their own systems. If you two were in that meeting with them, what would you ask for? What are some exact specific demands you would have?
You know, our health systems have been subpar for so many years. You know, we have to look at starting from the bottom up to designing our system with our communities. And we have started. We began work this past November and in January to hear what the people want. So we're looking at reform. We're looking at building capacity in our communities. We're looking at developing a regional system that best supports our people. Like what Chief Gaius said, too many of our members have died needlessly to preventable illnesses and injuries. So we need to look at reform, but also transformation of our system. So that's what we're looking at when we talk about meeting with the Prime Minister. We need to have those discussions so that way our people can live healthy. They can live, you know, good lives in the communities where they don't have to leave. So these are some of the things that we want to see in our region, in our communities, is to transform those systems to better suit the needs of our people.
And as a follow-up, Chief Wesley, you hinted at this in your remarks. Last night, the National Chief put out a press release saying she had actually formally requested attendance at this meeting, and she says the Prime Minister wrote back promising to advocate on behalf of Indigenous people, but he didn't invite her to the meeting. My question is, what type of message does that send about the state of reconciliation in Canada?
Well, it's not reconciliation. There needs to be a First Nation leader that needs to be part of these tables, these discussions. Because the national chief has lived in the Mushkegowuk region, and she knows firsthand the challenges of the people. The Prime Minister, as far as I can remember, since he became into power or during his time as a member of Parliament, he's never visited the Mushkegowuk region to come and see, to learn firsthand what the challenges are our people are facing. And I think it's very inappropriate for the Prime Minister to say that he will represent the First Nations in these tables. It needs to be a First Nation leader that needs to be part of these discussions when it comes to health transfers to the provinces. And I think it's I think it's a wrong step that the Prime Minister has taken, and we're hoping that the First Nation leadership can be part of these discussions moving forward. Thank you.
So, Michelle Similero, Canada's National Observer. Obviously, healthcare becomes, like education, becomes a tricky thing for a lot of Indigenous communities because on reserve it's a federal issue. When you leave off reserve to go into community, it's a provincial issue. And now, there's hopefully, I guess, there's a worry that First Nations issues will be way down the agenda in these meetings, but there's no transparency around it. Can you just speak to a little bit about that concern that First Nations issues will be, or healthcare issues will be spoken about in these meetings without that First Nation leadership, and then from that, then what is the demand then, not just to be at that meeting?
Not being at these meetings and not having our voice heard in regards to healthcare is very disappointing. They don't know what we live. They don't know what we go through to access healthcare. Even in our remote communities, how can they say they can advocate for us and say what's best for us? Is totally way off base. Are they trying to fix us again? That needs to stop. They need to have true partnership, nation to nation relationship with us in order for us to be successful. And, they're not respecting our voice by saying, we'll advocate for you. That, to me, they don't have the experience, they don't have the knowledge, and they're not Indigenous. They're not First Nations. So I'm very disappointed, that we're not there and that they're advocating on our behalf when really our First Nation leaders should be there. So that's what I'm worried about. Are they going to fix us again?
Coming from that, I just want to follow up with B, I guess. I've been to a lot of these press conferences, particularly with Liberal announcements about funding, and it's always about, we've done colonization for 150 years, never again, we're handing over power to First Nations. Hinting to the kind of paternalism of Canada for so long, and yet it feels like it's kind of a hypocrisy, perhaps. There's kind of a renewed paternalism saying, we will advocate for Indigenous communities. Can you speak a little bit to whether or not you think that this government is serious about handing over power to First Nation communities in terms of policy, in terms of healthcare, in terms of sovereignty?
I know they have good intent. They've come up with devolution processes, but really, with reconciliation, it's nation to nation, not just, giving us what is. We need to improve the system. We need to look at transforming. And like I said, it needs to be nation to nation, not, I will advocate for you when we're there. So it's disappointing.
I think what the federal government would love to do is I think they'd love to devolve a broken system. but what they don't want to do is put the money on the table to have equity. And we see that in education, the huge gaps between what they will pay for a community, for a school in Kashechewan or Attawapiskat compared to what they'll pay for students at the provincial level in Timmins. How the province and the feds continually play games over jurisdiction. We saw that with the whole Jordan's principle. You know, just before Christmas, I spent right up to Christmas Eve trying to make sure that special therapists for dealing with Indigenous children actually got paid by the federal government. They were legally obligated to, and nobody but, I mean, we were actually had speech pathologists who were losing their jobs because these bills weren't being paid. That's the inequity. So the government talks all they want about downloading or offloading and creating a new system. There has to have funding that's equitable. And equitable in a northern community isn't the same as equitable in Mississauga, because you also have to deal with the huge costs of getting supplies there. So if the federal government wants to talk about a new relationship, the money has to be on the table. That's what the provinces are saying. The provinces are saying, we want to see money on the table. That's what all this discussion is about. So they have to be saying, the Prime Minister's can't advocate for any of these communities. He needs to say, you're right. We have chronic underfunding in your communities. We have left you negligent for years. If we are going to have a new relationship, show us the money. So, any other questions?
I'm
Do you
going
have
to check
anyone
online.
online?
If the reporter is connected, have a question, please use the raise hand function to notify us of your question. Si vous avez une question, vous êtes en ligne, utilisez la fonction lever la main pour nous aviser de votre question. There are no other questions.
Okay. Thank you very much. Merci.